Welcome, everyone. Thanks for joining. I'm probably going to give it about 60 seconds or so to let people trickle in before we begin. Welcome. We're going to get started in just a second here, letting people get settled. Hello, welcome to today's webinar, Leveraging Whole Grains to Reduce Healthcare Spending. Um, I recognize a lot of familiar faces here, so I think some of you may already know who I am, but just in case not, I'm Kelly LeBlanc. I'm a registered dietitian, and I'm the Vice President of Nutrition Programming here at Oldways. And these are my disclosures. No commercial support or funding was provided for this webinar. All right, so these are our learning objectives for today. And I am going to quiz you at the end, whether you're watching this live with us or you're watching the recording. So these are the things you'll especially want to pay attention to. And then in terms of housekeeping, keep an eye out on your email. Hopefully we'll be able to send the CPEU certificate, the slides, and the recording this Friday. But if not, definitely sometime next week. So keep an eye out for that. We will have time, hopefully, to do a Q&A session at the end. So as you think of questions, if you could submit them using the Q&A function in Zoom rather than the chat function, just so they don't get lost. And yeah, stay tuned through the end of the webinar to participate in our interactive assessment. So before we begin too, I just want to mention that this is our third webinar of the day as part of our Whole Grain Academy, our spring whole grain event, which is really focused on educational topics around whole grains. So we do still have one more webinar this afternoon. It will be at 5 p.m. Eastern, and it will be all about like food processing and the NOVA classification system, which is a really hot topic right now. So we're really lucky to have an expert in this field be joining us. So hopefully I'll see you guys one more time today. Okay, so just diving right in, quantifying healthcare cost savings from increasing whole grain intake. So in this study, researchers actually analyzed 4 different models for measuring the health savings of eating more whole grains to identify best practices and inform future research. They found that while the results varied from one study to the next, each method did identify substantial health savings. We're talking thousands of dollars per person annually at the national level if people make more of their grains whole. And these don't have to be big shifts at all. The required increase in whole grain intake was as little as like a slice of bread or a bowl of cereal. So we're going to take a closer look at some of the studies that were included in this analysis over the next few slides. Eating more whole grains could lead to substantial savings in healthcare costs, even in countries where whole grains are already a regular part of the diet. In this study, researchers created models to analyze how eating more whole grains relates to type 2 diabetes for people in Finland, and then quantified the resulting healthcare costs as well as the costs related to work absences. They found that increasing the number of Finnish people who eat whole grains daily and or increasing the number of servings of whole grains daily, um, a number of servings of whole grains eaten by habitual whole grain consumers in Finland could lead to a savings of, anywhere from 286 to 989 million euros over a 10-year period. Additionally, the researchers estimate that these modest increases in whole grain consumption could substantially reduce disease burden as measured by saving 1,300 to about 154,000 quality adjusted life years. Um, we're reducing disease burden, and by reducing that disease burden, that costs our healthcare system less money, or in this case, the healthcare system of Finland. Across the globe in Australia, Australian adults are only eating about 21 grams of whole grains per day. In this study, researchers quantified the savings in healthcare and reduction of lost productivity costs associated with a reduction in type 2 diabetes and heart disease through meeting the 48 grams per day whole grain recommendation. So if 100% of the Australian adult population were to meet this whole grain goal, the researchers estimate a savings of up to 750 million Australian dollars in healthcare and lost productivity costs for type 2 diabetes, and an additional $717 million in healthcare and lost productivity costs for heart disease, totaling more than $1.4 billion in savings. Now, that's if we get everyone in the population to meet the whole grain goal. But even at the low end, even if only 5% or 15% of Australian adults were to make it to that 48 grams of whole grain or more per day threshold, there would still be an estimated savings of 73 million to 220 million dollars respectively in healthcare and lost productivity costs related to both conditions. So Finland is an example where people already have a culture of eating a lot of whole grains. Australia, perhaps not so much, perhaps a little bit closer to what we might see in the US, but in both cases, even modest increases can really have a huge impact on healthcare costs in the country. In this study, researchers calculated the reduced risk of heart disease associated with each serving of whole grain consumed. They were then able to model various scenarios of increasing whole grain consumption as a proportion of total grains, getting closer and closer to that recommended level outlined in the US dietary guidelines. They found that if whole grain intake was increased to meet recommended levels, so an increase of about 2.25 servings of whole grains per day, the estimated direct medical cost savings from the reduced risk of heart disease in the US was $21.9 billion annually. Further, they found that even small increases in whole grain intake can translate to substantial cost savings. A modest increase of just a quarter of a serving of whole grains per day was associated with a savings of about $2.4 billion annually. So again, like it would be wonderful from a public health perspective to shift our entire population to fully meet all of these whole grain recommendations. But public health change is incremental. And with these small steps, we really are able to see a measurable difference. And all of these savings I'm mentioning, yes, are annual savings. Great question. Okay, pop quiz. I'm going to try and see if I can get this poll feature to launch. Okay, which of these is the largest contributor of diet-related cancer costs? Okay, got some people participating. Wonderful. Um, Biggest contributor of diet-related cancer costs. All right, I'm going to give you a few more seconds. Now I am closing the poll and I'm going to try and share the results with you. Okay, so it's kind of mixed across the board, what people think in terms of the biggest contributor of diet-related cancer cost. And hopefully you will get your question answered on this next slide here. Okay. So a healthy diet can reduce the risk of many types of cancers. So in this study, researchers estimated the 5-year medical costs associated with different diet-related cancers. Diets low in whole grains actually accounted for the highest medical costs at 2.76 billion over 5 years. And after that, diets low in dairy and diets high in processed meats also significantly contributed to the economic burden of cancer. In terms of different diet-related cancer types, colorectal cancer was linked with the highest medical costs. And the relationship between whole grain consumption and colorectal cancer is very well documented in the literature. So it kind of makes sense that, this very expensive cancer that is unfortunately quite common in our country, could really be offset by having more people consume more whole grains. Um, and when we talk about, risk of disease, whether it's cancer or heart disease or things like that, I think a lot of our patients and clients might start with fruits and vegetables or fiber or things like that. And those are all super important as well. But when we dig into the data, it's not getting enough whole grains that really is making some very significant contribution. So. And I'll share the references at the very end too, and you'll get the slides with the references in case any of these studies are something you want to dig into more. So again, many public health campaigns focus on fruit and vegetable intake, but perhaps a wiser approach would be to expand the focus to whole grains, nuts, and seeds. Researchers analyzed Canadian eating habits against dietary recommendations and then calculated the disease burden attributable to not meeting specific dietary guidelines. And then from there, they were able to calculate the direct costs, so like hospital visits and medicine, and the indirect costs, like labor, associated with not meeting a particular dietary recommendation. They found that about $13.8 billion Canadian dollars per year can be attributed to an unhealthy diet, which is more than the economic burden of not getting enough exercise at only $9.3 billion. Only. I mean, it's still a big number. Additionally, they found that not getting enough whole grains and not getting enough nuts and seeds were the two biggest contributors of this cost at $3.3 billion each. Nutritious school meals can support children's health in the short term, and new research suggests that these benefits can extend into adulthood as well. In this study, researchers used comparative risk assessment frameworks to estimate the short-term and long-term health impacts of fully aligning the U.S. National School Lunch Program with the 2020 to 2025 dietary guidelines for Americans. So, if all school meals were to fully comply with the dietary guidelines, researchers estimate improved BMI and blood pressure in the short term, as well as 10,600 fewer deaths from heart disease, diabetes, and cancer in adulthood. These health improvements would save an estimated 355,000 disability adjusted life years and an estimated 19.3 billion in medical costs each year. While many aspects of current and proposed school nutrition standards are already aligned with the dietary guidelines, which is great, stronger school meal standards for whole grains, added sugars, and sodium are what is needed to be able to fully realize these health benefits. Um, and for those of you who aren't sure where we're at with uh, school meal standards, we've had a lot of different legislation introduced over the years, but right now, school meals do contain some whole grains, but they're not quite required fully to be making half their grains whole, which is what the dietary guidelines recommend. We had some kind of flexibilities that were put in place at the beginning of the pandemic when sourcing was really difficult for schools. And the goal was just to be as flexible as possible, keep kids fed, and, try and sort things out to go back to our most nutritious standards once the food supply settled down a little. But for the whole grains, it never did return to that making 100% of grains whole grain rich, which is a euphemism for making half of your grains whole. So anyway, that's where we're at right now, but we write blogs about this on the Whole Grains Council website, and we also have information where you can learn more about the USDA guidelines and school meals. So the past several studies we've looked at were about savings on a national level, whether in the United States, Finland, Canada, Australia, across lots of different countries. The numbers might look different and the established cultural eating habits that people have in these places might look different, but we're seeing a similar story that nations could save a substantial amount of money annually on direct and indirect healthcare costs, if people were to make more of their grains whole, which is wonderful. But what about us? What about you and me? What about savings on an individual level? And where do whole grains fall into that? Eating a healthy, well-balanced diet is known to help prevent numerous chronic diseases. So it's no surprise that eating healthier can reduce healthcare costs too. In this study, researchers analyzed U.S. eating habits against dietary recommendations and then calculated the cardiometabolic disease burden, so heart disease, stroke, and type 2 diabetes, attributable to not meeting specific dietary guidelines. From there, they were able to calculate the costs associated with not meeting specific dietary recommendations. They found that diet-related healthcare costs were $301 per person annually, or $50.4 billion total for cardiometabolic diseases alone. Specifically, the per person annual cardiometabolic cost of not eating enough nuts and seeds was $81. Seafood omega-3 fatty acids was $76. Vegetables and legumes were $60. Fruits was $57, and whole grains was $45. So basically what they're saying here is that by meeting your whole grain recommendations, you could potentially save $45 annually just on cardiometabolic disease burden. So just heart disease, stroke, and type 2 diabetes. Obviously, there are a lot of other potential areas for improved health and improved health savings, whether we're talking about some of the cancers we looked at on previous slides, or things of that nature. But just taking this little look at it, it makes me think of that phrase that some people say about, investing in your health and seeing how eating a more balanced and healthy diet can help save you money. So, related to whole grains, we hear a lot about fiber. Fiber is a really important nutrient for everyone, but particularly for the elderly to help prevent constipation and improve quality of life. And yet, many older adults are falling short on fiber. So, this was a really interesting study where they basically surveyed a bunch of dietitians, nearly 700 dietitians, who were working in long-term care or elderly care to answer questions about exploring barriers to whole grain consumption in older adults. They found that 89.5% of dietitians reported that they do want to serve more whole grains. So most people, 27% of dietitians reported that cost was a barrier to serving whole grains in long-term care. And yet, 75% of dietitians report that their patients need fiber supplements that average upwards of $11 to $20 per month per patient. And this study was in 2017, so I can only imagine that the supplements cost even more today. Given that whole grains are a natural source of fiber, whole grains may be able to offset some of the cost of fiber supplementation. Other factors influencing the decision to purchase whole grains in long-term care included dietary needs like special considerations for kidney disease, existing food contracts with their suppliers and distributors, nutritional content, and acceptance by residents. What about grocery inflation? So in the previous study, we found that about a quarter of dietitians report price being a barrier to whole grain consumption. So let's take a closer look at that. Grocery inflation has skyrocketed across the country. According to the USDA, most 2025 grocery inflation will be driven by higher than average increases in prices for eggs, sweets, non-alcoholic drinks, and fresh fruits because of factors like avian flu and tariffs. They estimate that grain products are predicted to have a much smaller price increase. And then within grain products, well, what about whole grains? What about the cost of choosing whole grains? The reality is that the cost of upgrading to the whole grain option is really quite minimal in many product categories. So we're going to take a closer look at the numbers on the next slide. So a few years ago, we did a kind of informal grocery audit where we went to our neighborhood grocery stores to compare a whole grain version and a refined grain version of the same type of product from the same brand. So if a brand makes the spaghetti pasta shape in both whole wheat and enriched wheat, comparing those two. Or if a brand sells a box of white rice and a box of brown rice of, a comparable size, um, comparing those two things. So let me just say that the prices that you see on the left were collected pre-COVID, so they will have certainly gone up now. But, regardless, we did have a lot of interesting findings. In our grocery audit, we found that pasta, rice and rice products, flatbreads, crackers, and snacks were all areas where whole grains were very often priced equivalently to their refined grain counterparts. In each graph, the dark colored bar is the price of the whole grains version, and then the light colored bar is the price of the refined or enriched version. So while there are some brands that are more expensive and some brands that are less expensive, the whole grain version itself wasn't drastically higher than the refined version. And in each of these cases, it was actually equivalent. The main exception that we found to this was when it comes to sliced sandwich bread. While some like of the premium brands of sliced sandwich bread had level pricing, the more entry-level price points and the store brands, so the brands that people who are most price sensitive are probably shopping, still did show a gap with the whole grain breads sometimes costing as much as 32% more. But that being said, the big pricing gaps tended to be the exception to the rule across a lot of product categories. And we have a much more detailed version of this infographic on our website. Um, obviously we don't want to include any brand names right here, but we have a lot more information on our grocery audit process. And I think this would be really fun to do again in this new grocery environment. But for our patients and clients who are price sensitive and who really genuinely want to eat healthier, but feel like costs could be a barrier to eating more whole grains, I would say to take a look at the refined or enriched products that they're already in the habit of buying and see if that company makes a whole grain version. Because in a lot of cases, the whole grain version is really not going to cost more. So this could be a good opportunity, especially when money is tight, to go with the better value product, the products that's going to offer bigger nutritional bang for your buck. So we've talked about healthcare savings costs for governments and for nations as a whole. We've talked about cost on an individual level and, can ordinary people save money by eating more whole grains? Do whole grains really cost more at the store? And now there's another area of cost I want to touch on, which is the climate cost. Investing in food systems that prioritize whole grains is also a wise investment in the face of climate and agricultural uncertainty. And there is a climate cost to diets that replace whole grains with other food groups. According to the Eat Lancet Commission, the optimal diet that meets basic nutritional needs and can be sustainably produced gets most of its calories from whole grains. The authors suggest that a global shift towards these dietary principles can prevent approximately 11 million deaths per year and can substantially produce enough food for the growing population without further damage to the environment. Um, and I think this really beautifully illustrates how whole grains are going to be really important when we're trying to feed a growing population with limited agricultural resources. Of course, we want people eating lots of fruits and vegetables. Those are very nutrient-dense foods, but they're not very calorically dense. And in order to help people meet their recommended nutrition needs, with their diet, they're going to have to shift more of their foods that really offer them the biggest nutritional bang for their buck. And whole grains are really right up there in terms of being able to provide a lot of nutrition, but also being requiring very few inputs agriculturally. These are crops that don't need as much water per calorie as a lot of other types of crops. Um, we're using the whole grain. We're not discarding any of the essential components of the grain. So there's really a lot of benefits here. As stress on our food system increases, certain dietary patterns may increase harmful environmental impacts. Diets that are nutritious and sustainable, such as those low in animal products and higher in plant-based foods, have been proposed as a solution to this issue, which still meets dietary needs. So in this study, researchers analyzed 150 different dietary patterns from different countries and different regions by pairing an estimate of food demand with an estimate of commodity prices in different years, with consideration of any food system and socioeconomic changes. Across the dietary patterns sampled, the most affordable and sustainable were vegan or vegetarian diets that replaced meat with legumes or whole grains. The least affordable were pescatarian diets that centered around fish, fruits, and vegetables. And both of those options are clearly very, very healthy. But again, back to the cost and affordability, it was those whole grain and legume focused dietary patterns that were the most affordable and sustainable. Staple crops like cassava, maize, or corn, as we would call it here, plantains, potatoes, rice, soybeans, sweet potatoes, and wheat tend to be the most affordable ingredients used in any of these diets. Household food waste accounted for 29% of all food costs, nearly a third. So helping people to reduce food waste could improve both affordability and environmental sustainability. China is the second most populous country in the world, meaning that dietary shifts at a national level could have drastic health, climate, and even financial impacts. In this modeling study, researchers estimated that if all adults in China were to eat about 1 more ounce of whole grains per day, the total indirect and direct healthcare savings related to type 2 diabetes, heart disease, and colorectal cancer alone would be an estimated $56 billion annually. Further, because whole wheat flour and brown rice tend to have a lower carbon footprint than their refined counterparts, eating 1 more ounce of whole grains per day is projected to reduce carbon emissions by over 5 million tons. And, as our climate resources and our natural resources may be in short supply in generations to come, there's savings on so many levels. Like we're looking at cost savings, we're looking at environmental savings, we're looking at health savings. Like it really is a win-win-win. I think here in the United States, a lot of the conversation around whole grains really starts from a place of nutrition, a place of health. Um, Most Americans recognize that whole grains are healthy. They've heard the term whole grains. They know they should be eating more of them. And that's really what drives a lot of the familiarity of whole grains. But around the world, there are a lot of other motivations that get placed front and center. I had the opportunity to travel to China a few times and participate in some conferences around increased whole grain intake. And it was interesting because there they kind of started the conversation with sustainability in some cases, just because compared to the United States, so many people live there. At that they were looking at the food waste element of whole grains. So, for example, in a very rice-based culture, you have your kernel of rice that has its outer bran, its inner endosperm, and then its inner germ. And rather than polishing off that outer bran to produce a white rice, if you were to keep the kernel intact as a brown rice, then you would get a higher yield, of usable food from the same patty of rice. So you would be able to feed more people with less food. And again, in a country with a very, very large population, these, small differences in yield make a huge difference in resulting food waste. So it's kind of cool to see like around the world the different ways that people are talking about the benefits and what's resonating in different places. Around the world, civilizations have adapted to their given climates with a diverse array of food traditions and cuisines, leaving some to wonder how we can possibly move towards a more sustainable diet without alienating cultural food preferences. Researchers at the University of Delaware recognized this dilemma, so they created models to identify country-specific dietary shifts to improve sustainability while still being culturally appropriate. And the key ingredient to their approach was whole grains. Um, in a November 2021 study published in Environmental Research Letters, the authors concluded that increasing the share of whole grains to make half of grains whole can improve nutrition, increasing protein by 7%, increasing iron by 37%, and increasing zinc by 42%, thereby offering a strategy to overcome the nutrient depleting effects of elevated CO2. Because it goes both ways, right? Like as there is more CO2 in our air, unfortunately, our soils are not going to have as much nutrition. And so we're really going to need the more nutritious option. Further, this study found that increasing the prevalence of C4 cereals over C3 cereals is more environmentally friendly. And basically, what this means is C4 cereals are grains like sorghum and millet that undergo a special type of photosynthesis that produces a four carbon compound, hence C4, which this four carbon compound reduces water vapor losses. And then C3 cereals are grains like wheat and rice that have a slightly less efficient photosynthesis process that produces a three carbon compound and is slightly less water efficient than the four carbon cereals. Um, and then also in this study, they wanted to control for cultural acceptability. Like, will people eat these C4 cereals? Millet and sorghum. So to do that, basically they used the maximum historical share of those grains in each country's diet between 1961 and 2011. They weren't going to propose that a particular country eat 100% of their grains as, say, millet or something. They looked at the maximum amount of millet or other C4 cereal that was eaten in that country in recent history to see like, okay, this is what people will actually eat or have actually eaten. So overall, it came out to be about like a 10% increase over current levels. And then to control for the cultural acceptability of whole grains, the authors simply proposed a modest shift of making half of the grain supply whole grain. The authors concluded that the combination of increasing whole grains and increasing C4 cereals in particular would result in strong co-benefits between increased nutrient supply and reduced environmental impacts. Best of all, these proposed shifts are based on realistic changes that would not disrupt the prevailing food cultures. The authors reminded the readers that all of the crops considered within each country have been and still are cultivated and consumed locally, thereby ensuring the presence of local knowledge regarding effective crop management and food preparation techniques. Um, and this, again, I think was a really cool study, and it does remind me of more research that we see that talks about whole grain acceptability being driven to exposure. So the more that we're offering whole grains to people, the more they're being exposed to them. And we are able to see in the literature that this increased exposure can additionally help drive acceptance. And I think that's one of the reasons why the study we looked at the beginning of the presentation around children in schools is particularly powerful because these are kids, they're, building their habits, they're letting their little taste buds develop. So it's a really great intervention point for us to start increasing the exposure to whole grains and helping people develop a palate for them because it's not just about improved nutrition. It's not just about healthcare savings, climate savings. People want to be happy and enjoy the food that they like. So that's a really great way to cultivate the appreciation for the flavors that whole grains bring. So to kind of wrap up some of our findings that we've gone over so far, nutrition is a key element of preventive health care. Our models are able to put numbers to this. We are able to see that nutrition and preventive health care do make a measurable difference, especially when we're looking at cardiometabolic diseases and diet-related cancers. Increased whole grain intake is a simple shift that can give people the biggest nutritional bang for their buck and can save billions in healthcare costs. And another message I want to leave you with is that investing in food systems that prioritize whole grains is a wise investment in the face of climate and agricultural uncertainty. So whether you are joining us here live or you're watching the recording, we are going to do a little interactive assessment here with some poll questions. These are my references. And again, we'll send out the slides um, and the recording hopefully this Friday, but if not, sometime next week. So you can review any of these things. And I haven't checked the Q&A yet, but once we finish the assessment, we should definitely have time to answer some of your questions. So as you think of things, please do type them in using the Q&A function in Zoom, and I will take a look. But first, let's get a couple polls going. Okay. So, fully meeting the recommendation to make at least half your grains whole in the US could save what? We know we could save individuals money. We know we could save, healthcare savings for our country. But where do you think this is? I know it's tricky to remember the exact numbers because we talked about it like 45 minutes ago, but all right, I'll give you a few more seconds. And I'll share the results here. Okay, so kind of a mix of what people were thinking. And if we go back to the studies, that would be A. Individuals can save about $45 per year in cardiometabolic disease costs. And the US could save about $21.9 billion a year in heart disease costs. Um, so obviously a lot of different studies use different tactics for measuring these things. But it's kind of cool to see that the benefits, apply not just to like the healthcare system as a whole, but also to regular, ordinary people. Okay, second poll question. How much more whole grain needs to be eaten in the US to be able to see a savings of $2.4 billion in heart disease related costs? So how much more whole grain do we have to eat to be able to see this amount of savings? I'll give y'all a few more seconds. Okay, I am closing the poll now and I'm going to share the results. So it looks like most of our respondents selected one additional serving per day, but it doesn't have to be that much. As little as a quarter of an additional serving per day can lead to a savings of $2.4 billion in heart disease related costs. And if we're eating much more than that, half serving, one serving, 2.25 servings, the costs will be even greater. So a lot of good reasons to eat more whole grains. So I will stop sharing that. And then our final kind of assessment is really a reflection question for you to think about as you go about the rest of your day, the rest of your week, and as you're working with patients and clients. So be thinking of some examples of nutrition treatment strategies that you can implement with patients to increase both the quantity and the variety of whole grains in order to improve health outcomes. So that's something we would love for you to get out of this webinar. And if you have questions related to that, please do drop them in. I'm going to open our Q&A now, so hopefully I can get to some of these. Someone comments that they are inspired to try teff and sorghum again because it's been a while. We have lots of teff and sorghum recipes on our website, wholegrainscouncil.org. And we also see more and more products at the grocery store being formulated with teff and sorghum, which is kind of cool. I've seen like popped sorghum. Like it looks like the cutest baby popcorn. And I've also done that at home too in the Dutch oven. So I think we have a TikTok about that. What kind of training for doctors would be beneficial to make a significant impact for their patients? So for our physicians, I would definitely encourage them to seek out continuing medical education related to nutrition. There are a lot of different conferences that sort of integrate food and health and nutrition and lifestyle medicine. And my other tip for doctors would be that they're not in this alone. To work with their dietitian on their team, refer out when needed, um, and be able, by working as an interdisciplinary team, we're going to be able to make a greater impact on more people. So hopefully, they don't feel alone in what they're doing, and feel comfortable reaching out to others who may have that expertise. Um, we do have another webinar at 5 p.m. If you let me actually stop sharing so that I can drop the link to that in the chat. Our 5 p.m. webinar will be about like food processing and the NOVA classification system. So let me just drop that in the chat so that you can register if you would like. Um, when we talk about whole grains, of course, we're talking about grains that contain all of their original bran, germ, and endosperm. Most of a grain kernel's nutrients and flavor are concentrated in the bran and the germ, and are routinely stripped out when a grain is refined. So, for example, if you take whole wheat kernel, you can mill it into a flour. And if you keep all the pieces, if you make whole wheat flour, that's a whole grain. But if you're sifting out some of that bran and germ, then that would be a refined grain. Similarly, if you have a kernel of brown rice, you can eat, the kernel that will have all of its bran, germ, and endosperm. But if you're polishing off any of that bran or germ to create white rice, that would not be a whole grain. And there are so many great examples of whole grains, from A to Z. We feature a lot of them on our website. We also have a lot of information on our website about the difference between fiber and whole grains. We just did actually a really cool handout for National Nutrition Month. But basically, fiber is just one nutrient in whole grains. Like whole grains are a food group that contain fats, proteins, carbohydrates, magnesium, vitamin E, folate, and so on and so forth. And fiber is just one of the many nutrients. So, as dietitians, we always try to direct our patients to whole foods that will, give them the most optimal full spectrum of nutrition. And instead of just having a food with added fiber, if you're able to have a food that's formulated with whole grains, they're going to be getting so much more than that. So let me see if I can find the handout I was talking about so I can share that in the chat. One moment. Yes, everyone will have access to the presentation. It is being recorded, and we'll send you the slides and the recording, hopefully by this Friday, but if not, by sometime next week. More understanding. Yeah, many of you in the same boat. Public health change does not happen overnight, but every little step is worth it. Will you share citations? Yes, definitely. I have my full references list in my slides, so y'all will receive those. when you get the email with the slides and the CPEU certificate and the recording. Let's see. Oh, PUFAs are polyunsaturated fatty acids. So it's that type of unsaturated fat that's found in nuts and salmon and that type of thing. Someone asked about arsenic in rice. So arsenic is a naturally occurring element in the soil. And rice, I think, is just a particularly thirsty crop that upticks or like absorbs a lot of the elements in the soil. And I know that's been in the news a lot lately. So we have some more information about that. I think for me, one of the biggest surprises, because you hear a lot about arsenic in rice, is that rice is not actually the biggest source of arsenic in American diets. It's fruits and vegetables. That was something I was very surprised to learn. And I know that USA Rice has like a really helpful fact sheet with citations. They're obviously monitoring that very closely. Um, and so that would be a good place to start. We do have, I shared this in a webinar earlier today. There was a study about parboiling rice to kind of reduce arsenic levels. And then what else did I want to share with you about this? Um, Yeah, I think those were the main. Oh, I was going to mention where the rice was grown. So, because arsenic lives in the soil and can affect all sorts of crops, like not just rice, but also apples. I know you see stuff in the news about apple juice too. Um, uh, we find that a lot of the rice that's grown here in the US tends to have slightly lower levels of arsenic than rice grown in other places. But if you guys want to write me too, I actually have a lot more information about this topic I can send. So I'm going to drop my email in the chat here. Perfect. Um, Someone asked if they can cook white and brown rice mixed 1-to-1 in their rice cooker, or is the timing too different? I've never tried it, but honestly, I would say give it a try. Like, I think maybe the white rice might be a little extra fluffy, but I don't think that would be a bad thing. Um, so I would definitely try that. I saw like a mom blogger talk about introducing whole wheat pasta to her kids, and she did half whole wheat pasta, half conventional enriched pasta, and she called it zebra pasta with her kids. So it was like half and half, and I thought that was super cute. Um, is there any research regarding the impact of increasing whole grains on sarcopenia in older populations? That is a really good question that I do not know the answer to. Um, I would love to find out because we do know that whole grains have approximately 25% more protein than their refined counterparts. And we do know that protein intake is associated with sarcopenia. So I think that would be a really interesting thing to study to see, if there's a relationship between whole grains and sarcopenia. And maybe there are studies out there. I just haven't dug into it yet. So, oh, love that question. Question about the whole grain stamps. Yes. So the whole grain stamp is a packaging symbol that says the gram amount of whole grain in one serving of a product. So that's a really great tool for helping people find products, one, that contain whole grains, see how much is in there, and then work their way up to products with more and more whole grain. So for our patients and clients who are like just beginning their nutrition journey, just beginning their whole grain journey, perhaps they would start with products that have maybe a smaller number in the whole grain stamp or that use the basic stamp. And then as they get accustomed to it, They can find products that make at least half their grains whole by seeking out the 50% plus whole grain stamp or seeking out the 100% whole grain stamp, which indicates that all of the grain ingredients of that product are whole grain. So yes, stamp is a really great tool for your patients and clients. C4 cereals, that is we're already at time. I'll finish answering this, but C4 cereals are grain crops that like go a special type of photosynthesis that produce a 4-carbon compound rather than a 3-carbon compound. So basically, they're crops like millet and sorghum, and they produce less or fewer water vapor losses. Um, so there is this when we share the slides, we'll share the study that really dives into that. I'm no agriculture expert, but okay, everyone. Thank you for all these really good questions. Thank you for joining us. And hopefully I'll see you back here at 5 p.m. So, all right, bye.